All right, everyone, I got Peel Envy doing Adele's treatment, so I'm gonna enlighten myself. Hi over here. I'm filming on 2 cameras, so if I look back and forth, that's why. I'm on Dr. Emer's Instagram Live and on mine. So if you guys just watched on Dr. Emer's Instagram, I was doing an enlightened peel on one of my coworkers, and whoo, this is strong. This is really good for anybody with pigment issues. And as you probably already know, I have melasma, which is a chronic skin pigmentation condition, lifelong, caused by hormones, heat, stress, and the sun, obviously. So I'm gonna let you zoom in on this. All of this darkness here, all this is gonna get lifted from this peel. So we're doing Enlighten Mask. And I'm just prepping my skin. I just extracted my skin. You can probably see some little bumps here. Had to get the pores clean first. And now we're prepping to apply the Enlighten Peel. And this is super strong. Feel free to ask questions. I'm watching you guys. Whew. Really, really, really strong. So this peel is good, like I said, for anybody with pigment issues. It's great for pores, for texture, good for all skin tones. Traditionally, chemical peels aren't that great for darker skin types because you can get rebound pigmentation from it. This peel is actually gonna stop the formation of pigmentation because it's gonna suppress the melanocytes. It's the area in the skin that creates the pigment. And the way it does that is it inhibits an enzyme called tyrosinase, which is a key component in the formation of pigmentation. All right, I think my skin's prepped. So here we go. This contains a high dose of hydroquinone. It's 8%, and that's that pigment inhibitor. It also has a high dose of retinol, which creates cellular turnover. Retinol is derived from vitamin A. It basically tells your skin to shed every 3 days or so instead of the 21, 28-day cycle that most skin has. Let me get a spatula. So this is gonna go on my skin. I'm gonna leave it on tonight and hang out for 8 to 10 hours before I wash it off. And let's do this. So for me, I'm probably gonna have, since I'm fair and more sensitive, about 2 weeks of light redness and shedding. The downtime is similar to a sunburn, so I'll probably wake up really red tomorrow, and I'm gonna have flaking, shedding, and dry skin. And I'm gonna get it up close to the under eye because this helps with dark circles as well. Hi everyone, I'm trying to see what you're saying. Hi Amanda. She just did this. She did a brightening peel too, and she's only a week out and her skin looked really good. So this doesn't really feel like much. Traditionally, chemical peels will have some sort of burning sensation. Doesn't feel like really anything. It just feels like I'm applying a mask, so that's nice because this has to stay on for the rest of the night. No, it doesn't hurt. Hi, Sarah. How often do I do peels? You know, it just depends. Honestly, I've been slacking lately just because I've had a lot going on. I usually like to do some sort of at least a medium depth peel every couple months. And I honestly haven't done one in a while. So I anticipate this to be pretty dramatic looking. I have a lot of dead skin built up. But really for me, the reason I want to do this is because I have melasma. So I want these melanocytes to chill out. I have the lovely pigment mustache, which is unfortunate. A lot of women get melasma when they're pregnant because of the surge of hormones. I've never had kids, but I have melasma, so it can really happen for any reason. I assume that mine is sun-related because I live in Southern California, and even though I wear sunscreen every day and I wear hats when I'm outside, it's really hard to avoid the sun. Plus, I'm very fair. And I have a lot of sun damage as well, surprisingly, for how much I stay out of the sun. But they say you get the majority of your sun damage before you're even 18. So I guess I can blame my parents for that. So just applying, trying to get it really even. Nice. What are you using to get rid of the melasma on your upper lip? I want to know. Do you use hydroquinone, retinol? Amanda, you're cracking me up. She said her skin looks like a baby's butt right now after doing this. And it's true. It really evens everything out. It also helps with texture, which is great. There's really no way to shrink pores, but if we get rid of texture and we get all of the buildup out of the pores, we can improve the appearance of them. So anytime you're doing these sorts of exfoliating peels or treatments, dermabrasions, things like that, it's gonna make the pores appear smaller. It's called Enlighten Mask, and this is actually by Revskin. Dr. Emer helped create this, which is pretty cool. So they've been testing it out for a while now, and I think we've perfected the formulation. If you guys have seen us do these before, there's been a different consistency in some of them, and we finally kind of pinpointed how we want it to apply. And it spreads really easily, which is nice. Someone said they've been using hydroquinone and retinol from their dermatologist, but hasn't seen a difference. What is the percentages, you know? That makes a difference for sure. Also, what else are you using for pigment? There's so many other ingredients that you can use along with the hydroquinone and retinol to really target pigmentation. If you do have melasma or any sort of pigment issue, you should definitely be using an antioxidant every single day. That's going to prevent free radical damage from the environment and the sun. So it's going to scavenge any bad factor that enters your skin that could potentially leave you with pigmentation. It also will help. Vitamin C helps to lighten and brighten as well. Looking good here. It's hard for me to tell you what laser would be best for you without seeing your skin, but we actually really love the Clear and Brilliant here for pigmentation, and sometimes we'll apply this peel right after doing it because the channels of the skin are open, so everything's open, ready to accept whatever product we put on after. So if we double down and we do that combo treatment, we're seeing really, really good results. It does make you a little bit more sensitive. It can extend the downtime depending on how sensitive your skin is, so that's one factor to take into consideration, but for the most part, all of our patients have really loved the combo of the Clear and Brilliant with the Enlighten Mask. And I'm gonna get right up under the eye, get rid of these dark circles. The product is called Enlighten and it's from Revskin. Does it look even? Mm-hmm. Yeah? Trying to see every little spot on my face. So again, this contains hydroquinone, retinol. We're suppressing the pigment production. We're lifting all the dead skin. Does it look okay? Up in here? Thanks. I have Ian over here helping me out. Hi, Reve. All right, so my skincare regimen is gonna look like this. Well, tonight in 8 to 10 hours, I'm gonna remove this. Then I'm gonna apply the maintenance products, which contain retinol and hydroquinone as well. And those are the key that I need to use for the next 2 weeks because that's really what's gonna get the results. It gives you a little dose of these ingredients that are in the mask every single day so that we can advance the peel. So the downtime, about 2 weeks of light redness and shedding, similar to a sunburn. It's really not that big of a deal. I'll keep you guys posted. I'm gonna check in with you every day and show you what my skin looks like so you can see how this looks during the process. But it's really not that big of a deal. We recommend doing enzyme masks to digest the dead skin buildup. That way, at least you can cover the skin with makeup. So to answer that question, yes, you can wear makeup during this process. I'm the type of person that when I do these things, I'm like, I just don't look great and I don't care. But yes, of course, if you feel like you need to wear makeup, you can do that with this peel. If you guys saw me do Rev Peel a couple months ago, my reaction was very dramatic for that. This I don't anticipate to be as crazy looking, which is good because it's 2 weeks. Does it burn? No, it doesn't. It feels just like I'm putting a mask on. The only thing that's kind of a bummer is that it's got to stay on for so long, so I have a feeling that I'm going to start to like want to itch or scratch or touch my face, so it's going to be hard to keep my hands off, but I'm going to do my best. And what other questions? Is that it? So thanks for tuning in. I will keep you guys posted. I'm gonna check in tonight when I remove the mask to show you what it looks like. And then for the next 14 days, keep popping in to see how this turns out, all right? Mwah, bye.